edition of Roadway to Health, an hour-long program brought to you by the Ministry of Health. It is, of course, designed to educate, inform, and empower Liberians about health-related matters, giving the tools to make informed decisions about your health. Today is Tuesday, September 2nd, 2025, and driving you through this edition of the program are Angelina and
Melvin Stewart.
and of course, we're joined by Agustin Gaima, Communication Officer, who's here making sure that you get access to this program through the Ministry's official Facebook page. However, we are joining us this morning, wherever you are joining us from, we'd like to say welcome. It is always a pleasure to be here with you. Well, this morning we have invited in studio um, four esteemed guests. Dr. Solomani A. Kone, consultant geologist at JFK. We have Ms. Anna B. Kume, founder of Model Health Campaign. Mr. Dennis J. Blade Jr., President, Liberia Medical Students Association. And we have Josephine A. Siki, Public Relation Officer from JFK. They are set this morning to provide education and awareness on prostate cancer. Stay with us as we take a very short break to be back. Welcome back and thanks for rejoining us. We now join our guests in studio, beginning with Dr. Kone. Good morning.
Good morning, studio guests, studio presenters and the listener. Good morning to everybody. As you heard, my name is Dr. Solomani Ahmed Kone. I'm the consultant geologist at JFK Medical Center.
Yes, good to have you here.
Thank you.
Okay. Let's hear for you, Dennis.
Good morning. It's a pleasure to be here today. Dennis Jackie Jr. I'm a final year medical student, EMW School of Medicine, and president of the Liberia Medical Students Association.
Okay. Miss Anna.
Yeah, good morning, everybody, and I'm very honored to be here this morning. My name is Anna Blamonti Kume. I'm a nurse based in Ghana, and I'm also the founder of the Mondi Health Campaign Project.
Okay, Josephine. Welcome.
Thank you. Good morning. My name is Josephine A. Siki. Deputy Population Officer of JFK.
Okay.
I'm happy to be here.
Okay. It's good to have you here this morning. So, Melvin?
Okay, so let's begin with Anna. Yes, I'm coming. Let's begin with Anna. Just tell the people listening to you, even though you say you are the founder of a Monday,
Yeah.
but let's hear you swore as you explain about Monday and why you think Monday was established, why you think you brought it to Liberia.
Okay, so it's actually Mondi Hope
Okay,
Foundation
Monday.
that started as a health campaign project. I believe that as a nurse, we all have a responsibility as health professionals to also contribute to the achievement of the universal health coverage. And looking at the population generally, there are more people and fewer health professionals. And then, as the saying goes, prevention is always better than cure. What good is the knowledge you have at the point of death when you cannot really offer much help to a patient? So why don't I put the knowledge I've gained into use by creating awareness and then to promote good health and well-being? That's how come I started the health campaign project with colleagues of mine, and we are all in Ghana, and this is my first time visiting Liberia. I'm looking forward to more opportunities afterwards.
Oh, well, welcome.
Thank
Welcome to
you.
Liberia. And I mean, that's a really good thing.
Thank you.
Yeah, so, Dennis, you are president of the Liberia Medical Students Association. How is the association?
Okay, thank you very much. Firstly, the Liberia Medical Students Association is the umbrella organization for students studying at the EMW School of Medicine, and those are students studying to become medical doctors. So this organization ensures that we guide the activities of the students seek their welfare, but also as aspiring healthcare professionals, it's also our responsibility to ensure that the public is healthy. So aside from caring for the welfare of the students, we also engage in the well-being of the general population. So reaching out to them with projects or other educational series or so. So these are things that we are very involved with. So it's part of the organization we wanted to be here too. So.
Okay. So let's dive into our discussion, which is the prostate cancer. And I'm here with Dad today. Dad.
Yeah.
Okay, so we are talking about prostate cancer today. But firstly, let's establish what prostate is before deepening our discussion into the cancer and other things.
Okay, thanks for that question. The prostate or prostate gland is one of those male reproductive gland. It is part of the internal reproductive gland, and the prostate actually sits just at the bladder neck. The bladder neck. You know the urinary bladder? That is where the urine is stored after it is made in the kidney. So the prostate sit there. It surrounds the urethra, and normally when it is not enlarged, it doesn't interfere with the gastrointestinal system. But when prostate becomes big, sometimes it also blocks that. So it surrounds the urethra. So it being part of that male reproductive organ, it contributes to the production of the semen or the sperm that we generally call it, contribute to that.
Okay.
So in terms of volume, it is estimated that prostate contribute up to 70% of the fluid that come out eventually as the sperm that we all know it to be. Yes.
Okay, so what are the functions, like
Okay.
the different functions of the prostate?
So the prostate actually is an exocrine gland. Naturally, just like a prostatic secretion, prostatic fluid. That's the main function of the prostate. So it contributes. It is estimated that up to 70% of the semen that comes out, 70% of it is from the prostatic fluid. The rest of it will come from the testes and then the seminal vesicle, and then part of them. So the most important function is that prostatic fluid secretion. Yeah.
Dude.
Then apart from that, it also produces very little amount of prostatic specific antigen, right? But the prostatic fluid, the importance of it is that it helps in liquefying the sperm, making it more dilute so that the sperm cell can travel easily after ejaculation. So,
Okay.
yes.
So what about prostate cancer?
So prostate cancer is basically stands for cancer of the prostate gland. So cancer is abnormal or uncontrolled growth of the body tissue. So the name cancer actually take their name from the organ from which it originates from. For example, you have breast cancer, and you have it starting from the breast. In this case, we have prostate cancer. So abnormal growth and uncontrolled growth of the cells of the prostate gland. So normally cells are supposed to grow and die through a process we call apoptosis, organized self-death. For example, every cells will grow to a certain extent, and after a certain time it dies, and then replaced by new cells and replaced by new cells. In the case of cancer, when those cells start to grow, then they continue to grow uncontrollably, and that's what makes it cancer, prostate cancer.
What actually causes prostate cancer? What is how does one come down with prostate cancer?
Yeah, so this is a very important question. There are so many factors or risk factors that are associated with prostate cancer. The first, number one of it is being a male sex. It is only men that have prostate gland. So if you are not a man, then you cannot have prostate cancer. So sex is one aspect of it. Then the genetics or race example, it is said that people of African descent have higher incidence of developing prostate cancer compared to other race, right? But then apart from that, there are other risk factors like aging, for example. As people increase in age beyond 40, then the chances of prostate cancer continue to increase. For example, below the age of 40, the risk of prostate cancer is less than 1%, even though we have seen a 20-year-old patient with prostate cancer. That was my first of it. But as you advance now, between 40 to 59, 60 to 79, 80 above, that incidence or percentage of prostate cancer continue to increase. So age is a very significant risk factor of prostate cancer. Then we also have some other factors like sedentary lifestyle, people who always don't exercise, and then obesity. Sedentary lifestyle or physical inactivity is also can lead to obesity, as we all know. So obesity and sedentary lifestyle. Or then apart from that, smoking is another risk factor for prostate cancer. In addition to excessive alcohol indulgence or being an excessive alcoholic, all those ones can lead to. Then you also have some other real risk factor like genetic mutation, for example. And then chronic infection, for example, chronic STI, sexually transmissible diseases can also lead to chronic inflammatory process in the prostate that may lead to prostate cancer in the future.
So in because you spoke of something very significant, I want to get a clear understanding on that. I know the listeners too are interested. Looking at sex, I've heard many say that excessive sex contributes to prostate cancer. Am I correct?
No, that is not exactly correct. What to say is contracting sexually transmissible diseases can increase one risk of prostate cancer. There is a theory and that is being studied, and it's an ongoing research that excessive ejaculation can reduce the chance of prostate cancer. You understand that? The excessive sex and ejaculation. It doesn't have to be through sexual intercourse, masturbation, or any ejaculation. That is ongoing research. So excessive ejaculation is supposed to be protective as far as that ongoing research is concerned, even though it's not conclusive. But if the sex is not protected, and in the process one has multiple sexual partners, and then that person develop STI, then that may even be more against you than in support of protecting prostate cancer.
We also have before us here. If a brother or father has prostate cancer, the possibility of the family coming down with prostate, the entire family is something that is
It doesn't. The possibility of what?
Of the entire family coming down with prostate cancer, whether it's linked.
It's actually that increases one risk of prostate cancer. First degree relative being diagnosed of prostate cancer is a risk factor. That is one aspect that I forgot to tell you. So family history is a risk factor of prostate cancer, and that is part of the genetics.
And does that mean it travels through the gene?
Yes, some of it. It's not all of it.
So,
the genetic link with it is very high.
but what's the age range more vulnerable to this? Like small child babies come down with that too?
Children, babies, I've not seen a recorded case of babies. I told you I've seen one.
20 years.
The first
The
was
first
20,
time.
around 23, 24, 25. For the first time.
In
Apart from that,
your life as a professional.
in my life as a professional, even though there were record of it in literature, but it's not common. Very rare. Usually, the commonest type of prostate cancer is not usually involved in those early stages. So those ones are mostly related to infection, chronic infection, and then the development of other type of prostate cancer. The commonest, maybe you have a space for that, the common type of prostate cancer, especially that affect the people of advanced ages, the elderly, middle age elderly. So the more advanced in age people are, the more chances of them developing prostate cancer. At the age of 80, it is estimated that close to 70 to 80% of people who are in 80 years of age will develop prostate cancer.
Okay. Well, let's hear from you, Blue, on what I just said. What do you have to add to that?
I think the age of people at the hospital.
The discussion with around prostate cancer.
Okay. So generally, like Dr. Kone has said a lot about it. The prostate, if men, it's cancer of the prostate gland, there are risk factors, there are certain stuff. But I think what I want to add now is that like with the issue of the myth of excessive sex, there are also other things too that people think if you have prostate cancer, it's not advisable. Like first thing I want to mention is that prostate cancer is treatable. Cancers are usually the ones that we think that is a death sentence. Like once you get cancer, you're at the end of it. But prostate cancer can be treatable once it's caught early, and that's the main reason why we even in the business of raising awareness, so that you can come to the facility very early, and we can work our way around getting it sorted out. And also for those who are aware a bit about it, there is a fear that maybe if you come for the treatment, you might experience erectile dysfunction. That is like after they treat you for prostate cancer, you wouldn't be able to function very well as a male. That's a major concern for men. But so far as the literature is concerned, there is a huge possibility that after the surgery you will still remain functional and you will have no incontinence or whatever. So it's important as men to get regularly checked. Since we spoke of the 40 years, especially like I said, even though it's a possibility that it could be at a younger age, but it's more common as you age, right? It's more common as you age. So in that instance, that means you have to, at a certain age, visit the hospital and check. And there is one simple test to do, a prostate specific antigen that mentioned, which is a normal antigen produced by the prostate. But then if your prostate is abnormal, it gets a little higher, right? Depending on, it's not specific for cancer, but it gets higher depending on the abnormality of your prostate gland. So it could be either there is just inflammation or there is just an enlargement, because it's not like every time the prostate is enlarged, then you have a prostate cancer. There is also the benign prostatic hyperplasia. Like hyperplasia is like the cells in the prostate gets more and it gets bigger, but it doesn't have the potential to metastasize. Like the ideal what we use for cancer is to metastasize, like to spread to other parts. That's why we fear cancer in the first place. So once you get it, it spreads to every other part of your body. It gets to involve everything. So yeah, but that one, the gland is enlarged. You may have the symptoms, but it's not a cancer. And the cancer is the one that it has the potential to spread other parts of the body, the bladder, the bone, and other structures. Yeah, and also I want to point out that there are some signs that you might see that maybe you want to think that, oh, okay, even though I've not gotten the regular screening, but I need to go to the hospital. Like maybe as a male, you're experiencing blood in the urine, you want to look out for that. You're having incontinence, or you're having continence, like you're keeping urine longer, urinary continence, like retention. That's the proper one I want to use, like just continence. So you're having urinary retention, like because the gland is surrounding where the urine is supposed to pass to come outside. Once it gets too big, it squeezes on that particular structure, and then it's like the traffic is black, so urine is not coming. So those are some of the common things to see. If you're having problem with that, come to the hospital. It's not definitely prostate cancer, but it's something that you come to the hospital so that we can examine you and tell you what exactly is
Yeah, so I mean, prostate, you just out now. I think one or two of the symptoms are what we want you to just tell more about the symptom because prostate cancer, prostate itself, there are other conditions, right? I mean, people are the experts. Like you mentioned, one of them the enlargement and other different ones. So maybe somebody will see the enlargement, they will think, oh, this is cancer. Yeah, so let's outline the symptoms mainly for the cancer.
Yeah. So the thing about signs and symptoms, except for a few that would be pathognomonic or that would be, very indicative that it is this disease, they're usually things that point to the disease. That's what we have to do further testing to diagnose the patient. So symptoms that the patient may have, like I said, you may have blood in your urine or the semen, the entire thing that is male ejaculate, right? People have painful or burning sensation when you're urinating. People have difficulty having an erection when you are male or 40, you're having problems, whatever you try is not really working, right? Or you're having pain while you're ejaculating, or you're having frequent pain or stiffness in the back. Because it's something that moves to the spine as well. So people have pain in the back as well, or constipation or narrowing. Like if they were to check someone's prostate in the clinic, they go through the anus to the rectum. And that is because the prostate is just in front of the rectum. We're able to see it from there. So if it gets large, if you also press on that other pathway, and aside from having problem with urinating, people have problem with even defecating, you having constipation as well. But all of these things, they are not 100%. Like you can't just see them and say, oh, you have prostate cancer. These are signs that you should come so that we can do the investigation and properly diagnose you for prostate cancer. So those are the signs and symptoms.
Let's hear from you, Miss Anna. All right, I want to appreciate the doctor. He's a urologist specialist, and his inestimable experience is more enlightening. And then, just to buttress what Dennis said, I think with the signs and symptoms, it is not specific because there are so many other conditions that could cause similar signs and symptoms. However, at the early stages, you can't really detect prostate cancer. So once you are regularly checking yourself, maybe once every year, if there is any abnormality, it can be detected then. And then also at the advanced stage, you also may experience anemia because cancer, as he said, it spreads to other parts of the body, organs and tissues. So one of the places the cancer can migrate to is the bone. Once it infiltrates the bone, because in the bone marrow there is what we call production of blood cells, red blood cells. So once this cancer spreads to the bone, the person might have constant low HB or experience symptoms of anemia. And then we can also talk about unexplained weight loss because the cancer cells are diverting the nutrients that the body is supposed to use to themselves. So the person experiences weight loss, low HB, and then they experience pain in their joints, their bones, like they literally feel uncomfortable, having weakness, easily fatigued, and what have you. Okay. So that, let's come to you again a little bit. Let's talk about preventive measures.
Yeah, so it is better to prevent than to cure, as is commonly said. So preventive measures are very important, and that start with history. For example, for people with family history of prostate cancer, it is important that if one has that, then you should be on the alert for the possibility that you could also have it. So in that case, going to do what we call early screening even for you, it is good. Because somebody without family history of prostate cancer, we don't encourage that random screening like that because it also has its own side effect. Yeah, because there are certain stages when we don't necessarily do something we call watchful waiting for people who have been diagnosed of prostate cancer. Right, we do that. But first, let's talk about the prevention. So it's good to prevent it. If one has a family history, it's good to screen. That's number one. Then number two, healthy lifestyle is another way of preventing prostate cancer. You know, we like for example, we talk about some of the risk factors or etiological factor, like excessive fat ingestion or excessive ingestion of excessive red meat and processed meat, and then smoking. You know, we talk about that as a risk factor. So other way of preventing this is to reduce the ingestion of processed meat or red meat. That's another way you can prevent it. And other means of preventing is to reduce the excessive drinking of alcohol. Smoking is a very important risk factor, not only for prostate cancer, but for so many other cancers. So it's good to actually quit. If one is smoking, quit smoking. And if one has not started smoking, then one should not get into it. Then apart from that, exercise, right? No, exercise has a lot of benefit. Apart from good weight, maintaining good weight, and other things, you can manage weight by doing regular daily regular or daily regular exercise. It doesn't have to be too aggressive, but the one that you can manage and you have to be regular with it, you can lose weight. So all of that one can help also prevent prostate cancer. Then good and healthy diet. For example, diet rich in fruit and vegetable, right? So it's good for people to eat a lot of fruit, mango, apple, and some of the available fruit that are common in our community, vegetable, spinach, and other things. Yes.
You want to add to that?
Yeah, so with the weight, I think most of the time people might want to just check their weight, but the weight alone doesn't only give a full information. I think we have what we call the BMI, body mass index. So it is your weight divided by the square of your height in meters. So to be able to check whether you are obese or not, you should, when you check your weight in kilograms, and then you divide that by the square of your height in meters. Then you can check online for what we call the BMI chart. So the BMI chart will give you more specific guidelines as to what result or answer or result you have from your checking, and then you see whether you fall within a healthy range, or you are underweight, or you are overweight or obese. That would
Let's hear you, Mr. B.
Yeah, so just on the same BMI stuff, so like when you do it, since she has given you the formula to do it, like it's something very easy to do. You weigh yourself, you usually count in kilograms, you check your height, even if it comes in feet and inches, you can use the internet and just convert that to meter, and then you do the simple math.
So how does it work for the old men in the village?
No, it might not be a very helpful tool for someone who doesn't have access to a skill. Yes, because you have to firstly weigh yourself, specifically weigh yourself in kilograms, or in a unit that you can convert to kilograms. But if you're in a setting where you can do that, then you should ensure that you're between 18 to 25. The BMI index should be 18 to 25. Then we're looking at an ideal index. That's where you should do it. So it's not like you just weigh and I'm 60 and the next person is 70. You think the person is bigger than you. You should also consider the height of the person.
So we will hear from you shortly on Josephine on the activities pending, but I wanted Dad to talk to us a little bit about the treatment options for prostate cancer.
We've already talked about the prevention, so the treatment option after establishing, because to treat anything, you have to diagnose it, right? So the history, as we heard from the other colleagues, will give you a clue to prostate cancer. We heard from our sister that early prostate cancer may not necessarily have symptoms, and that is very important. But when it is established that one has prostate cancer, there are two routes or general route to it, right? Especially at a certain stage when it is not symptomatic, for example. sometimes we can do something we call watchful waiting, especially if this person life expectancy is low and is likely going to die from other comorbidity, for example. Because certain grade of prostate cancer does not spread very fast. Prostate cancer is one of those cancer, especially second grade, and the one that happen in people with advanced age. The low grade prostate cancer doesn't spread. It may give the people up to 5 years. Treatment sometimes are associated with other complications. So for some people who have other comorbid conditions and they are likely going to die from that, right? So sometimes we watch for waiting and treat them symptomatically, or we do something we call active surveillance. That means watch for waiting, you come, we take your history, you keep telling us that, then we focus on the other diseases that we have, because, and then by that time we'll have known the grade of that prostate cancer and know that this is low grade prostate cancer. You understand what I'm saying? So we don't want to subject you to chemotherapy, we don't want to subject you to some other thing, because you're likely going to die from other diseases, right? That's one. But sometimes we also do something we call active surveillance. That means we also want to monitor the character of that cancer. We continue to examine you every time we book you to meet us in the clinic. Yeah? We do digital repair. Then we can repeat something we call prostate biopsy. To reach diagnosis, prostate biopsy is very important. Taking tissue of the prostate, sending it to the pathologist to look at it and confirm that this person actually has prostate cancer. And then so we do prostate biopsy. We may repeat that. And then while waiting to see what happened to you as it relates to other comorbid conditions.
How long does it take in terms of the monitoring aspect?
So you can monitor as long as, like people in their 80s, for example, people in their 80s or 90s who have diabetes, have this, have some other things, right? And then they have prostate cancer that is of low grade. Subjecting them to some treatment can even worsen some of their situation. So we continue to keep eyes on them as much as possible. By the time they start to become something symptomatic, we may intervene, or otherwise you can. Otherwise, there are other treatment modalities that we do is something we call, for example, androgen deprivation therapy. Because prostate cancer has a very big link with hormones that male may produce, is something called testosterone, that habit testosterone. So it has been implicated, is actually implicated in prostate cancer, because it is said that a man who is castrated at a young age never develop prostate cancer. You understand what I'm saying? Yes.
It works well.
Oh yes, you don't develop prostate cancer if somebody is castrated at a young age and is a man, never develop prostate cancer. So that link it. So it has a lot of link. And part of our treatment too is castration in the future for those who can afford certain medication. So yes. So
Is that common in Liberia?
Now we have advanced. Most of the medications are available at JFK, and the government has done a lot in encouraging partners to import some of this medicine. At the immediate post-war period, the medication we have now were not available. I did a lot of castration. Yes, because that was the only available option. And by then, those medications were, even if it is available, they are very expensive.
Castration, this is something strange.
Yeah.
That tell us, I mean, our listeners, how it works. Let me just break it down for them. Let them get it
What is
clear
castration?
understanding.
Yeah, castrating men.
Basically, in our simple English, is to remove the 2C. The 2 seeds, remove the 2 seeds. And by doing that, you cut off the testosterone supply. So prostate cancer, especially prostate cancer, it's a feed on the fluid that our testes put into our body that differentiate us from women. For example, the reason why you have my voice is not like her, why I have beard and they don't have beard is because of testosterone as opposed to estrogen in women. And that is produced by the testes. So by the time you cut that off for prostate cancer, then it spread for some of it reduces significantly.
And meaning the person will not born.
And let me tell you, an operator, an old man who was in his 80s, And the only thing I could do then was to castrate him, and he lived up to close to 100 years.
How do you feel when you're doing such a
How do
castration?
I feel? I'm preaching.
Like a
Now,
lifesaver.
someone who has been castrated and that,
Yes.
someone who has been castrated,
Mm.
do they still
But
have?
now we don't castrate. Oh, please don't think that we've changed. We don't castrate.
Alright.
The only castration we do, the castration we do now is chemical castration. We also call it chemical castration, right? So it's either surgical or medical or chemical.
Oh.
So the chemical now is to give medication or injection that block androgen, and that's what we call androgen deprivation therapy.
I
Good.
think it's
Sure.
possible to do that when you've already had your children, right?
Yeah.
Alright, so
Alright,
let's hear
so-
from you,
yeah.
Josephine.
She's the Deputy Public Relations Officer
Yes,
at JFK, right?
yes.
So let's turn the microphone over to her. Madam, welcome, yeah.
Yeah, thank you again. As you may be aware that the month of September is recognized globally as Prostate Cancer Awareness Month. In alignment with this important health campaign, the JFK Medical Center Liberia will actively participate in raising awareness and educating the public. The urologists at JFK will be seeing, testing, and patients as they come to be awarded 50%, and you go and they test you. And throughout the month of this September, we have planned a series of activities focused on the prevention of prostate cancer, early screening and detection, timely treatment and management. So we welcome the public to join us on this platform as we collaborate with the Ministry of Health to ensure that Prostate Cancer Awareness Month, this 2025, is resounding success in Liberia. So details about these activities, we will share it and update the public as we go about. So the JFK family want to say a big thank you to the Ministry of Health for always using their platform as we all think Liberia, build Liberia, and love in Liberia.
So let's look at the campaign. You said 50% waiver to people who will be coming for testing, and 50% will be solely undertaken by the people themselves, right?
Yes.
But what about those that are unable to come to Monrovia to come and seek these medical advancements coming from different parts of Liberia? What is JFK doing about this?
As you come to JFK will not turn patient down. We cannot turn patient down.
When I'm asking it, those not everyone will come from they will not, some people might not have the opportunity to come to JFK. Do you have a plan for an outreach activity?
I think Dr. Conan will answer that.
Answer that.
Yeah.
Actually, we want to express our thanks and appreciation to not only to JFK starting with JFK, but the Ministry of Health and Social Welfare. The urology unit of the John F. Kennedy Medical Center, the Liberian College of Physicians and Surgeons have been doing outreaches on a couple of occasions, and we hope to expand it. Apart from being part of the teaching forces of the Liberian College of Physicians and Surgeons that has 8 branches teaching hospital in Monrovia, Phoebe Hospital, and then Tapeta, the hospital in Tapeta.
Just enough to.
Jackson F. Hospital. So with the presence of those ones, we basically treat people on that regional basis. The surgeons in Tapeta we collaborate very well with them, and we sometimes visit them, right? Roughly about 6 or so months ago, we had a health campaign at Phoebe Hospital, basically concentrating on prostate-related diseases, and we did a lot of surgery. We took most of our modern gadgets, we do some modern surgeries in Liberia right now, thanks to the administration of the hospital.
Okay.
We do endoscopic surgery. We, the urology in particular, and other colleagues in general surgery also do it. So we moved with our gadget and we conducted our health screening education, health awareness. And apart from that, we also treated patients with prostate diseases. So we do how do outreaches, and we hope to expand it, especially now that the Ministry of Health and Social Welfare is supporting the process. So we are not, it's not limited, our intervention is not limited to Monrovia, even though we hope to expand it beyond the scope we are doing right now.
Yeah, you said that, Josephine, you said that the entire month of September, right, is prostate cancer awareness month. But I'm concerned about the actual thing that this activity came for, because you carry on screens and you want people to come and make use of the opportunity.
As I said, like next week, we will put up like an announcement to start, because the urology department have to go together and name out the necessary things that will be done. But screening will be done in the hospital,
Only at JFK.
only at JFK. Maybe Denise can say
Yeah,
something.
yeah. So it's like she said, the entire September is prostate cancer awareness month. So the Lagos Medical Students Association, in collaboration with the Monday Health Campaign Project, and also designed a bunch of campaign to raise awareness. So we are expected to have a health walk on the 5th of September. We're thinking to use the march from JFK over towards the Oro Market area, share brochures, with the people there, especially the older men, and educate them about prostate cancer. That is what we want to do. We are also partnering with the MPhil to ensure that during the 4th edition of the National MSA Conference, we will have a tent outside for the 3 days, and we'll also be sharing flyers, talking to people about prostate cancer, and spreading the awareness there as well. And we are also working with the Eurocare Specialist Facility. They too will also be providing 50% discount for all those who will be visiting the facility within this month to get screened for prostate cancer. We are still working modalities with other partners, and we are calling on other partners also, because Eurocare has an open slot. If we can get someone to help us contribute a little bit of the funding, the screening could even be free. Like they at that point, like if we could just provide a small portion. So we are open to other partners, because we don't want the 50% to be the reason why someone might not come, especially someone who is at risk. So we really appreciate our due plan is to have free screening for prostate cancer. But as it stands, we have the 50%. Also, we are looking to extend the health talk to different entities. We have contacted a few. We began this process a while back with the SIGA, the security firm. We had a talk with the men of age at the institution. It was a wonderful one. They were very receptive. They appreciated the knowledge. So we're intending to spread that across other entities within this one. Like maybe ELBC could even invite us and we could talk to men who are interested in prostate cancer awareness. So yeah, these are some of the things that we have planned for the month of September.
We are collaborating with Monday Health Campaign.
Yes.
And you are the founder, let's hear you.
Okay, so part of the reason why I came to Liberia in the first place, my uncle recently passed from prostate cancer, and at the time he had come to Ghana for treatment, he was already at an advanced stage, and then unfortunately biopsy was done, which probably exposed him to infection that triggered his condition getting worse. So I thought of taking the initiative to increase the awareness on prostate cancer, because it's something, even as a nurse, it's something that has not really caught my attention that much. We do a lot of awareness on other things, but we rarely would, champion prostate cancer. We do breast cancer, HPV, cervical cancer and stuff. But then we are talking about gender balance and equality, but then we are always focused on female-related health conditions. So I just got the motivation to link up with the Liberian medical students, and so far we've been doing our best engaging with other stakeholders. That's how come we got this platform from Ministry of Health. And then we are also looking forward to other more assistance and support as well.
Okay, this is very educative. I hope the males are listening. So we are opening the phone lines now so that, men listening can participate. So if you just join us, you're listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health. And we are in talk this morning with our health experts educating the public on prostate cancer. So to be a part of this conversation this morning, you can call us on 0880-514-096, 0880-514-096, or 0775-677-376, 0775-677-376. The numbers. We have a call. Good morning.
Good morning. So sad. Yes, so the numbers remain. Call us, and we don't have much time, so you call, just go straight to the issue. But let's take this person quickly from this line. Let me see if this person is. Good morning.
Good morning. Yeah, good morning.
Morning.
Yeah, good morning.
Good morning. Please go ahead quickly.
Yeah, my name is Wilton Fleming. I go to you guys for Tapetan District in Lima.
Go ahead quickly.
Yeah, thank you for the topic, I read, getting some education from what you're discussing. But my concern, I heard about some tests being conducted, and what have we done across the country. And my next issue is how to do it. I heard about they can do the test around the angle. So I don't know why somebody talking from power and all that thing has to be the thing which that too.
All right.
Thank you.
Thank you. Morning. Good morning. Oh, not too good. So that you want to speak to that? You
Yeah,
heard
so-
the first, the caller.
So the first question, if I get him right, is if somebody has hemorrhoid, and the test that's supposed to be done through the anus, which is what we call digital rectal examination. First, it is important to know that the part of the prostate gland that is commonly involved in prostate cancer are the peripheral glands, the left and right. The only site, or the only accessible site to feel, we call in medical term palpate or touch the prostate, is through rectal examination for person that is not undergoing operation. For patient, when you are screening the patient, there is no other way, other place on the body where you can feel the prostate gland. It's not like the breast where you go directly to the breast and examine it. So during the examination of the prostate, the only way we can access the prostate gland and feel it is through that rectal examination. So having a hemorrhoid does not prevent being examined, does not prevent one undergoing digital rectal examination. The only time when we do want to do digital rectal examination if people have certain condition of the anus that we call fissure of the anus. Fissure of the anus is very painful. When people are suffering from that actively, you treat that first before you think of doing any digital rectal examination. Apart from that, we will feel the hemorrhoid. We know that the hemorrhoid is there. And apart from that, we will be able to feel the loops of the prostate and all of the other structure relating to it.
Let's take this person quickly. We don't have much time. Morning.
Good morning, I'm David Coty. I'm 72 years old and I have done prostate test only once. That was about 5 years ago. And I'm interested. I want to say thanks to all of you institute. But you talk about 50% deduction. What is the actual charge that you're giving 50% on? I'm interested in doing another test. Thank you.
All right. Thank you so much, Mr. Coty. India, we don't have time because we have, the president is expected to break grounds for the two overhead bridges very, very shortly. So we'll be joining our outside broadcast team there to cover that event. So we can just get, we can take this short break and just wrap up and come back and just get the party comments from our guest. Please stay with us. We will be right back.
Studio. want to say anything before?